This is the ADL bedroom. I like to call it the apartment, which is one of the coolest things that we have here. So as I mentioned earlier, acute rehab is designed to be a transition to home. So what we're trying to do with all of these areas and these different types of equipment is to produce as close to a home environment as possible to train patients in so they can be prepared once they go home. One of the big things that we try to prevent is further injury at home or further problems at home. So the more we can duplicate in the rehabilitation setting what a home setting would be like, and the more we can predict or look forward with the patient and their family to what types of things they would experience in the home, the better we can treat them and the better therapy we can do for them to help them get over whatever injury or problem that they had coming to acute rehab. So we're gonna go inside here and you're gonna take a quick look around. Inside here we have what looks like an apartment or a hotel room. There's a reclining chair, there's a couch, obviously even a remote control, television over on this side, and a little dividing wall, and another chair for sitting. On the other side of the wall, we have a simulated bedroom situation with even some cabinetry and a dresser that might be similar to what the patient has at home. And as we come around the corner here, this is a training restroom. As you can see how we have it labeled, and there are grab bars in here, and there's a bathtub and a situation that we can set up to be as similar as possible to a patient's home situation. The great thing about the size and space of this room is patients can bring in the equipment with them that they would use at home. So if a patient is using a walker or a shower chair or a bedside commode, as you can see here, they'll use them here in this bathroom and they'll train here in this bathroom, and this should mimic as much as possible what their home environment looks like. Granted that their home restrooms and their home bedrooms would look and seem a little bit different, this at least allows us to attempt to duplicate the home situation and prepare them as best possible prior to going home for these types of things when they get into the home environment. And so this really helps us to optimize the therapy, optimize the treatment that we're doing with occupational therapy and physical therapy, get the patient strong enough in an environment that's similar to their home, and help them to get better and prevent any potential injury once they get to the home setting. Two other comments about this room that are important to mention. Number one is the carpet, and as it transitions into a tile or a hard floor. We want to train people on these types of different floors because in their home they're going to have different types of flooring and different types of terrain that they have to traverse. The other thing that's important about this room is this is a regular bed. This is a regular bed that you would find in the average home. This is very different than a hospital bed. A hospital bed has rails, it goes up and down, and it has different positions. If a patient spends only time in a hospital bed while they're here and they never attempt to transfer in and out of a regular bed, going home to their regular bed could be somewhat challenging, and God forbid they could have a fall or a problem transitioning in or out of bed. So training on a regular bed at this particular height is imperative to a patient doing well for bed transfers at home, and that's another piece of this room that we really like.